popcorn and everything.
Okay, I'll be right back. So how's you guys' day been so far?
Well, so far, mine's been good. Yep. Pablo has got this son to watch this. See, he puts two things together and makes it. Did you see that? Thank you guys for everything. Appreciate all your help today.
You're welcome.
Okay, well, I got the pair of San Antonio Shoemaker shoes today, and just wanted to show you guys real quick. This is the Ambassador in coffee bean, as you can see, right out of the box. Love the smell of fresh leather. Look at these things. Every one of their shoes is made by hand, as you know. If you go to the website, you can learn about that. And I love the fact that it's just a couple of guys, you know, they needed to improve the standard of quality and, you know, provide more comfort-feeling shoes. And I think they've done that. So I'm just looking at them now, but I can't wait to get these on my feet and wear them. And that's my plan. So another good view of this real quick, as you can see. I like this because this is both a casual shoe, it could, you know, with jeans, and I plan to put these on and go to work here in a little bit. By the way, these are Medicare approved for patients with diabetes, so these are diabetic friendly, and I know that's a huge issue for us in San Antonio and a lot of the world actually. So if you have diabetes and you need some comfort fitting shoes and you don't want them to look like a medical device, look at these. These things are completely approved for diabetes, and they look anything but a medical device. I mean, they look like a stylish shoe. So looking forward to slipping these on and trying them out. But one more sniff test. I can feel the love in these shoes. And it's not just because they're coffee bean. I do love coffee, but look at these things. Thanks, San Antonio Shoemaker. Okay, about to slip on my SAS or San Antonio Shoemaker shoes. Down numero 3, you share with us a little bit about patients with diabetes and their feet and why it's important that they take care of their feet.
Well, it's critical for diabetics to manage their health care so that their feet stay healthy, because they're very prone to having foot ulcers and other kinds of trauma because of the nerve damage that occurs with diabetes. Therefore, they're very susceptible to infections, very susceptible to trauma, they're very susceptible to calluses, and as a result, they have decreased blood flow to the toes, and they can lose parts of their foot, they can lose the entire foot as a result of poor diabetic care. And most amputations that occur in diabetics.
Interestingly though, I know Medicare has a program that there's certain shoes that they will actually cover. Could you maybe share a little bit about that and why that's helpful for patients?
Well, anything we can do that decreases the trauma to patients with diabetes, anything that we could do to decrease the amount of insults that a foot takes. So that's why these shoes, these are special shoes, Medicare approved, that limit the amount of damage to the foot. Therefore, it's much less likely they're going to have ulcerations or other kinds of trauma that would lead to an amputation. And we're talking about thousands and thousands of amputations, so that we'd like to protect it. And therefore, this is a way to do it. And not all shoes are really heavily protected for the diabetic, as diabetic shoes are specifically made so that there's more cushioning and better balance and just a better process for the diabetic foot.
Excellent. Well, I appreciate your thoughts today, Dr. Cohen, as always, and we'll look forward to reading up on standard of care, the latest on diabetes and some shoes and everything else that you're working on for that moment. So appreciate your time.
Thank you.